This is Vital Signs, a podcast on cutting-edge trends in health tech and the people shaping them. And today we have on an incredible guest in Warner Thomas, the CEO of Sutter Health. Sutter probably needs no introduction, one of the largest health systems in the country. And Warner's had a really fascinating experience having come and joined the system from Ochsner, where he also led that system. Really interesting conversation around all the different ways Sutter's using technology, how a system leader thinks about the key things that really matter, and a bunch of other key questions in healthcare. I think folks will really enjoy it. Without further ado, here's Warner. Well, Warner, thanks so much for coming on the podcast. Really appreciate it.
Hey, really, thanks for the invite. Glad to be here.
It's a real privilege of my job that I can just get to spend 45 minutes here with the CEO of one of the most important health systems in the country.
Well, thanks for the invite, and I mean, you guys do amazing things in the investing space, and it's an interesting time in healthcare, certainly.
It certainly is.
Yeah.
To start, I think our listeners are inevitably familiar with Sutter, given that half of them are on the West Coast anyway, and probably have firsthand experience with the system.
Sure.
But maybe just to start, can you contextualize kind of Sutter today, the footprint,
Sure.
and how that's evolved since you kind of joined in 2022?
Yeah, so I've been at Sutter almost 3 years now. Sutter is the 10th largest not-for-profit health system in America. We really cover the full continuum of care. Several hundred clinics, large relationships with, storied medical groups like the Palo Alto Medical Foundation Medical Group, the Gould Medical Group, Sutter Medical Group in Sacramento, Sandstone Clinic down in the Central Coast down in Santa Barbara. And then we have 25 hospitals across Northern California. We have a small insurance plan with about 120,000 lives. 12th largest home care company in America as well. So, a lot of people don't know that, and the largest operator of ambulatory surgery centers in the States. So really a comprehensive system.
I mean, you obviously joined, after a really long run over at Ochsner, another really large system in a different part of the country.
Sure.
One thing I'd love your perspective on is, obviously people always like to say healthcare is intensely local, right? And it's about serving the communities that are there. Maybe just talk a little bit about some of the differences you observed between what you were doing at Ochsner, what you're now doing at Sutter. I'm sure there's lots of similarities, but I'm sure listeners love that.
Yeah, so, I mean, two really different organizations and how they were configured and started. If you look at Sutter, I think historically a hospital-oriented, organization and was kind of hospital-driven and started from that. And so I think it's had a very hospital-oriented culture for a number of years. If you go back to the 90s and into 2000s, started to build, broader relationships with physicians and with the medical groups. But I think it's really been a very different organization, and how the organization integrated itself or didn't integrate certain components of the system has been, pretty different. If you look at Ochsner, it was really started as a physician group practice, with 5, surgeons getting together to build this medical group, and then evolved into starting a hospital, and then evolved to be, more of a system over time. The clinic and the hospital at Ochsner merged in 2001, and that's when Ochsner really started to expand and grow. So really the history and heritage is very different at how they grew up, and I think it also is why you see, at Sutter, we're spending a lot of time on how we integrate the organization, how we coordinate it, which are things that we really started back in 2001 at Ochsner when we merged the clinic and hospital together then.
Yeah. It's fascinating how these organizations can maybe look similar today, but based on where they started, it has this kind of cultural resonance down the line for many decades to come.
Yeah, and I think the that history and heritage drives a lot of how you look at the world, how you think about things, and how you evolve.
I mean, one thing I think is so interesting is you were talking about even the footprint of Sutter today, the fact that you have this massive, home care component of the business. It feels like there's just so many different things going on. What are the 2-3 things that you think about the most right now?
Sure. I think a couple of things. One, we are very focused on how we grow our ambulatory presence and our physician network. We've added, well over 2,000 physicians and clinicians over the past 3 years. We're opening up, over 30 new locations between the end of last year, 2025 and early 2026, to be able to house a lot of those physicians and clinicians. So really building the ambulatory network and physician network, big focus. The second, I would say, is being much more consumer and patient-oriented. We've been relentless about improving access, taking friction out of the experience for our patients. We'll book nearly 5 million appointments online in 2025.
Wow.
We're the #1 online appointment organization.
When did that all start for you guys?
Yeah, so I mean, look, Sutter was doing some of this and had made some great strides prior to 2022. I think we just really built on top of that as a team and accelerated it. Today our primary care appointments, 55% of primary care appointments are booked online. It's a much lower percentage in specialty, which we're working on. So
Is that just because the scheduling rules are more complex?
yeah, I think it's a little more complicated, and I think it's just where we started and kind of where the initial efforts were. So I think the consumer focus, reducing friction, better navigation, making it easier to use is a big focus. And I think the third area would be really around technology.
Yeah.
And we were talking a little bit about AI, but how we deploy technology to make it easier to work within Sutter, to care for patients within Sutter, and make it easier for patients to be seen at Sutter. So I think whether it's we're talking about a bridge and using it in ambient listening. We just developed a relationship with ADOC, and kind of on the radiology space and that, or if it's using technology in what we call chronic disease management. What we call as Sutter Sync, allowing us to take care of patients at home who have hypertension, diabetes, and connect with them multiple times per week at home versus a few times per year in the office. Yeah. Very different experience. So I would say it's really expansion of the ambulatory network, consumer and patient focus, and then technology and using that to care for our patients in a better fashion.
So many interesting things to dive into there. I mean, I guess on the consumer side, obviously you made this huge push into, online booking, a bunch of other things. How do you think about like the next frontiers of what the consumer experience looks like at Sutter as you think about the next 5-10 years for the system?
So our chief consumer officer, Jennifer Bollinger, and Laura Wilt, our chief digital officer, really drive a lot of this focus. And I think it's a number of things. I think it's how we help people navigate the system. Healthcare is complicated.
Yeah.
And helping people navigate to know where they need to be, what specialties next, what appointments, what tests they have to have, why they have to have them. We're building centers of excellence in neuroscience and cancer and orthopedic and sports medicine and providing those capabilities in a more integrated fashion.
How do you think about the balance of like people and technology there? Because I imagine you must get pitched by a million vendors that want to,
Oh, we do. Yeah, we get pitched by lots of vendors. I would say we think about it in, fighting fragmentation. Yeah. Really trying to not fragment the experience, but have it more integrated. And sometimes that's using different point solutions, but I think we're looking for more platform solutions versus point solutions. And that's a big focus of how we think about caring for our patients. But it's we have a point of view, right or wrong, about the future, about healthcare systems of the future. To be successful, we're going to have large ambulatory-oriented networks. Yep. You're always going to have hospitals, but being closer to patients, making it easier to be seen, moving more care into the ambulatory area. And that'll be coupled with and integrated with a digital ecosystem and digital capabilities that allow patients to go back and forth. Because people don't want just digital.
Yeah.
And they don't want just, in the office. And look, it's hard to navigate, right? To how much should be digital and how much should be in the office. And that's what we've got to continue to navigate and get right. But that is really our point of view and how we're trying to help people navigate between that. And some people would rather be in the office, and that's fine. And some people would rather have virtual care, and that's fine too. And we have to be able to tackle both of those situations to make sure we serve our patients right.
That's fascinating, this kind of like continuum of different care settings that people want and integrating that together. How do you think about what the like control panel for that ultimately looks like? Is someone accessing like, is it a person somewhere that has all that information or a piece of technology that like helps you seamlessly? Because I think that seamless transition between those sites of care is obviously a real challenge.
Yeah. I mean, we use the Epic, IT platform. It's kind of a backbone, but I think part of it is how do you use it more effectively and efficiently? How do you utilize all the components of the system and take advantage of those? And then how you build, sometimes it's not the technology, it's the workflow and the work redesign. Online appointments is not about technology. online deployments is all about behavior and behavior change and working with our physicians and clinicians to do it in the right fashion,
Right.
So I think it's a mix of behavior change. It's the component of building more systems that can integrate to Epic and use that as a platform. It's what we've done with Sutter Sync, is it's integrated into Epic. We have devices, blood pressure cuffs, glucometers, scales for weight, fully integrated into Epic. So there's no app; it's just fully uploaded. So the more we can make that easier, the more we can kind of build and integrate that clinical information and allow patients to have an easier experience. That's really what our focus is.
No, I love that. I mean, it's cool that the Sutter Sync especially is such an interesting vision for where things are going. I'm curious, obviously I feel like if you went to a healthcare conference over the last, decade, people have been talking about this stuff for some period of time. It's always much more challenging to actually get it implemented. And I don't know whether there's, you mentioned behavior change earlier, there's obviously technology. Does it feel like now is starting to become the time for some of these things? And how do you think about that?
I think we've been on an evolution. I think some organizations lean heavier into this than others. Yeah. I think I and my team, we've had this point of view of physical digital for a while.
Does being near the Bay Area help?
Yeah. I mean, the interesting thing, when I was at Ochsner, 6-7 years ago, we were bringing physicians to San Francisco to meet with tech companies here, meeting with, private equity or venture, organizations to just learn. Yeah. To really just learn what's going on. So, I would say, look, AI has accelerated some of this change in a very large way. I had my primary care appointment last week, had a, 30 plus, minute visit. I probably get a little bit more time. But
it's a high pressure visit for whoever the system is.
Yeah, exactly. My doctor, she's amazing. Literally, she turned off the abridge, on her phone and turned the computer screen and showed me the note. It was instantaneous. Yeah. And I read the whole note and I was like, I was like, wow, this is unbelievable. Yeah. And so these are game changers that are only going to get better, right? And I think that's how we have to lean into this in a very, very different way. And I think traditional healthcare organizations, ones that lean into it and embrace it and work hard at it and try to change the behavior and learn, I think will do well. I think others that don't, I think are going to be left behind. I think they will really struggle over time, given the changes that are happening. Because, look, I mean, everything we do in our life today, banking, airlines, consumer, we're doing on our phone. Yeah. And we're doing, from our iPad or device. And so I just think this to think it's not going to happen in healthcare is just not feasible. I mean, organizations will figure it out, and many have, right? And I think we want to be on the front end of that here at Sutter and continue to push into it. And I think given our proximity to the Valley and now to San Francisco and what's happening in AI here in San Francisco, I mean, I view it as the hub of AI. We're fortunate to be here, and we want to be a leader in this area.
It's amazing how quickly things can just become commonplace, right? It's almost like you can imagine, pretty soon it's going to be crazy to go to a visit as a physician and not have one, a tool like a bridge, or to be a patient and go there, and you're going to be like, wait.
It's going to be. You're still looking. It's an expectation. Like you've got to be able to have it, right? And so, but those tools have to get better and better, right? Of course. Because that's going to be. We were, I believe, the first one to work with a bridge to move it into the ER. We're excited to be a development partner there. Yeah. And look, there's lots of different tools out there. That just happens to be the one we're using. But this idea of how we continue to lean into that, make it easier to care for patients, easier place to work. Laura Wilt, our digital officer, we're tracking the saved hours. It was 1 million last year. It's 1.5 million this year. It needs to be multiples of that. And I think it will be, as, the 1.5 million is probably going to be understated by the time we get to the end of the year. So, we retooled our nursing documentation within Epic, saved 20% of the time in the system for nurses. So these are things about working smarter, about being more strategic. That's going to allow systems to do, better and to perform better. And I think that's what healthcare organizations are going to have to do in order to navigate what are going to be some pretty big headwinds in the coming years.
What other parts of AI are you paying attention to? Obviously, it feels like the ambient documentation has been this killer
Sure.
use case, and you mentioned AI doc earlier and some of the stuff on the diagnostic side.
Yeah.
But I'm sure you get hundreds of use cases across your desk. Like, which ones are you most excited about? Or
Yeah. So, look, I think we're seeing new ones all the time, right? I mean, I think looking at voice documentation into home care is going to be a big one.
Yeah.
I mean, that'll be a game changer in home care. I think, looking at, calls, working in our call center and just helping our patients, for things that are easier that we could do with some sort of AI generated voice recognition and technology to allow people to navigate simple things, or allow our employees, instead of dealing with somebody with benefit questions or pay questions. So I think there's a lot of administrative work there that I do think will automate over time, but I think a bunch of that will be probably with voice oriented answers versus just being text oriented, and I think that's going to be a big opportunity in the future. I think online coaching, whether it's mental health, or whether it's chronic disease, like we talked about. We've got in our chronic disease, there an avatar that you can choose the language, choose what you want your avatar to look like, that looks more like you, right, and kind of deals with helps patients kind of be educated, helps them understand what's happening with their results and that sort of thing. I think rev cycle, supply chain, I think are big opportunities for AI, and coding. We got to do it in the right way, but I do think all of those will be big opportunities for AI.
Yeah, it's fascinating because it feels like even if you just froze the capabilities of these models today, there's so many things you could go build within healthcare. But then also every 3-6 months, there seems to be a whole new set of capabilities. And so it must be fascinating as a leader of one of these organizations to figure out, it's like you have to have the plasticity of every 3 months, there's probably some new set of things that weren't possible before that now are. Voice, I think, being a great example of that.
Yeah, and I think, part of this is, and I think a challenge I have, and I know a lot of my colleagues have, is, how do we stay current? How do we learn, and how do you stay in front of this? And that's, I spend a lot of time, listening to podcasts or reading, and then talking to folks in the industry, because it is, just, it's exciting and also challenging, the speed of change.
We have a lot of startups that listen to the show, and I'm sure you've been through your fair share of pitches and maybe seen people do things that didn't go as well, in terms of kind of aligning with you guys. Any advice you have for folks out there, or things you've seen people do that maybe common mistakes folks make?
I think one of the things that happens is everybody thinks about they're going to solve this one little thing in the healthcare equation, and we're going to do it extremely well, and why don't you think we're amazing? And it's like, because there's 50 things we got to solve, not one. And now, how do you get to 50? You get one done and then you move from there. But I think this idea of, is it going to work across a continuum? Is it going to help us solve multiple issues? I think sometimes startups can get so focused on their one thing that they're solving, and they're like the best point solution for this one thing. And we're thinking, yeah, but we got to solve a much broader set of issues. And your solution is really not going to help us in that continuation. I think the other thing is, does it work and integrate with our existing legacy systems that, we're not probably going to trade out, like a Workday or Epic, So, I think, thinking about how that's going to work. The other thing is, if you've always got to, nobody wants to have 50 health apps on their phone. Yeah. I think it gets back to, we want it to kind of integrate through the Sutter app and making sure that becomes the gateway of where people, get to information. So I think those are things that people just need to think about when they're pitching or looking at these single point solutions, is many times there's a broader agenda we're trying to solve for.
Yeah. And obviously, I imagine the most effective ones can pitch some sort of entry that is really effective for something, but kind of paint the picture of like, hey, this is applicable and, 15 other things within the system.
And it's how we see it going. And I think the other thing is, and we want you to be part of how we develop this, and we're willing to do this with you. And so that becomes more interesting, right? Versus, hey, we just want to sell you something, and then we're going to kind of move on. That's probably not as interesting, especially if it's a smaller kind of startup organization.
You mentioned some of the headwinds kind of facing the health system industry earlier, and I think we're talking about some of the looming Medicaid cuts. Like, what does that actually, as you as the CEO of a system, like how does that kind of impact the what the future looks like for Sutter?
Well, it certainly creates a lot of uncertainty for lots of organizations, not just Sutter. And I think the way, the July 4th bill, single largest healthcare cut ever. So it's going to have an impact on states as well as healthcare institutions. So we are building our plan at Sutter of how we you can't. The cut's so material, you can't shrink your way through that cut. You have to grow your way through that cut. So, yes, we got to be more efficient. We got to look for cost savings. We got to look for efficiencies. But at the same time, we have to grow and expand and look at new patients we can serve, new areas we can go to be able to mitigate those changes. So, I think it's going to be really tough for rural entities. I think it's going to be really tough for some urban entities that are really, relying on Medicaid or Medi-Cal here in California. We are a very large provider to Medi-Cal, so it's a large change for us. But we feel like we got a good plan and we can navigate that. But I don't think others will maybe be able to do that because it may be too material, or maybe they don't understand the magnitude of the change. And so I think all of this is, people really need to try to make sure they can quantify it, understand the magnitude, and then, today we've started, going into 26, like what are the things we're going to change now as we go into 26 and then 27, and then really, 27, 28 is when the real major changes start. Make sure we are getting ready for those changes and can navigate them over the next couple of years.
When something like this happens, is there had you guys had kind of a plan as in like, hey, there's a possibility this, there's always possibility policy winds change, and so we have a plan here? Or is it like you get in a war room and kind of figure it out?
No, I don't think everybody has like the plan that they pull off the shelf of, okay, this is how we're going to
That'd be nice if it worked that way.
The Medicaid cuts. I think you have to be flexible. I think you have to be agile. I think you got to, be decisive. And frankly, we like to think about it as managing point to point. You've got to pick a path, keep moving, and then reassess. And then if you got to readjust, you readjust and move in a different direction. And that's kind of how we think about it, especially when you're going through times of big change or times that are uncertain. I think sometimes people get frozen. They don't make decisions, and that's not good. That is making a decision if you don't make a decision, right? So pick a path, make a decision, keep going, keep reassessing all the time. And not that you're going to totally change course, but we'll know more in 3 or 6 or 12 months than we do today. And so as we learn more, like what could we do? What would we do different? But as we set out our path and our strategic plan over the past couple of years, the fundamental direction is not changing. The speed of we do things or the prioritization of how we do things may change. Projects, come up, and some may accelerate to the top, some may drop back. But the direction of what we're trying to accomplish in those 3 areas that we hit earlier around, expand the network, and then tackle our consumer and our patient issues, and then tackle the technology, those are going to be really consistent.
What else are you paying attention to on the policy side?
If you look at healthcare in general, state and federal government are 2 of the largest payers that we have. So you have to pay attention to advocacy on a local, state, national basis. And so, it's interesting. I've been asked over time, like, what are the big things that I worry about? And I always say, some major change from a policy perspective was always something I really worry about, because I mean, with a stroke of a pen, it can have a very material impact on you. And I think in this situation, that's what happened. And once again, lots of different and good reasons for things, and things, people decide, and, our political leaders have to decide and, pick paths, and then we've got to adjust to that, appropriately. So I think that's what we're working to do.
Yeah.
And then working to advocate maybe modifications, or maybe things weren't quite exactly right, and are there ways we could modify the bill going forward, or things could be tweaked or whatnot. So hopefully we will see some changes in that legislation over the next couple of years. I mean, now we're talking about the ACA subsidies, and maybe those get extended a little. That would be great, right? So I think we'll see how this really plays out over the next couple of years. But hopefully there's some modification to provide more flexibility and more time for health systems in the future.
And one thing I think is interesting about this market is obviously you compete against a bunch of other great systems. And I'm wondering how you think about like the vectors of competition there, and what like ultimately, allows you to kind of win the hearts and minds of patients, versus these other great systems.
Yeah. I mean, I think one of the ways that we think about it is that, we have to have our game plan and go out and execute on what we have to do, and, for our patients, for our, physicians and clinicians, for our team members. And if we do those things well, I think we'll be fine, So I don't think we don't develop our plans kind of looking at our competitors, and because they have different, things that they need to focus on, they need to do. So I would say that we, once again, we keep our patients and our employee and team members and our physicians and clinicians at the heart of how we think about where we're going. And I think if we continue to just be excellent at getting better and better at that, implementing technology, navigating the policy and the payment issues, I think we'll be fine. I mean, if you look at Sutter, we've got a very large, geographically dispersed impact, which is, so we're not kind of, just in one area. We're in a lot of different areas, so that's a strength. You look at our clinical capabilities, versus maybe some of the academics here, who are amazing and fine institutions. But I mean, if you look at some of the things that we do at Sutter, I mean, our outcomes and capabilities are rival, and are as good, if not better, in many areas. And so, if you go to some of the academics, they're going to be dealing with a esoteric, specific thing that maybe is not our area of expertise, but 95, 97, 98% of the things we can take care of, and we do take care of, and people would rather have that integrated experience. And then, our physician model is open. We got these large storied medical groups. We have thousands of community physicians that we work with. So we have a little bit of a different system, and if you look at Kaiser, I mean, great organization, it's more of a closed system, and can't really leave the Kaiser system. So, you look at Sutter, more of an open system, and you have options to go different places. So I think that geographic coverage, the clinical capabilities, the physician network and model, and then the integration and the digital capabilities that we're building, I think really help us differentiate ourselves in the market.
Yeah. I love that. I guess, obviously being in San Francisco, you hear a lot of kind of, very ambitious visions for the future of healthcare and what it looks like in 20, 25 years. I'm curious, for someone who's been much more grounded in, both what's possible now, but also seeing the frontiers of all these technologies. What do you, to what extent does healthcare look completely different in 25 years, pretty similar to what we're doing today?
Yeah. I think healthcare has to look different. And I think for a number of reasons. This, we talked about technology, we talked about consumer. The single biggest macro issue happening in healthcare right now is the aging of the population. 11,000 people, 11,500, I think, is the exact, age into Medicare every single day. Every single day, for years. It's happened the past, 3, 4, 5 years, and it'll happen the next several years, probably decade plus. And every day that happens, every hospital, every physician in America has a payment reduction. That's just the reality of the world. And now we've got the July 4th bill, so there's Medicaid or Medi-Cal payment reductions. So those two headwinds are so material that you've got to be able to navigate and tackle those head on. So, we think over time, global payment or global budgets of Medicare will be much more prevalent. I mean, we see that some, but we are building the capabilities to be much more oriented to a global payment in Medicare, Medicare Advantage, if you will. We got two great partners in Alignment Health and Scan that we work with in the Medicare Advantage space, and we just think that is a better payment model over time because it unleashes innovation, allows you to take care of patients without just having the limitations of straight fee for service. But not all organizations are great at that. There's a reason they call it risk. It is, and you have to build the capability. We have a great dyad team, a partner, Burry, who came out of the Cigna organization, ran Medicare Advantage at Cigna, Conrad Vial on the network side, that are partnering to really drive this work.
Yeah.
And a specific team, we're building that capability. But I think, a lot of organizations are leaning away from this. I think the challenge is I just don't believe Medicare fee-for-service will be the answer long-term. So I think as we think long-term, I think it's just something we have to get good at. And that'll be, we'll see.
Yeah.
But I think that's a big macro
That's
issue.
fascinating. It's basically more and more of the population moves to Medicare. At the same time, you think long-term, more and more of that Medicare moves to value-based care. And
Right. And more value-based care drives digital,
right,
drives connectivity, drives prevention. So yes, I think with those things, you will see a different approach to the health system. It drives more care into the home.
Yeah.
So we got to be more connected to the home, and which is why it's great that Sutter has a big home care footprint. And so I think these things are really important as we think about how the healthcare system will evolve over the next 5, 10, 20 years.
And it's fascinating because I feel like there's all these different groups that are emerging that are like, we could help take on risk for, this population. There's folks that are more wraparound care around primary care services, primary care docs, systems. It feels like there's all sorts of different organizations that, potentially could be really good fits. But certainly the more comprehensive your services are.
And I would say that, this is one of the things that I think we did really well, our team did really well at Ochsner. Most of the Medicare business at Ochsner was under, some sort of global risk or global budget. And the team there, Eric Gallagher, kind of Bo Raymond, that lead that today. They did a great job. Phil Orovitz is there still. They do a great job. And I think that organization learned how to do this in a very effective way. Here at Sutter, we got, we're a little behind that curve right now. We're catching up quickly. And we got the right team members in place, but I think there's many organizations that just they don't necessarily see that they can navigate this. Yeah. They think fee for service is going to just fundamentally be funded differently in the future, which I don't think that's true. And I think working with an organization that has size and scale that can navigate these things, I think will be a real benefit for folks over time. But sometimes it's, and we see the insurance companies, building the delivery networks or integrating the delivery networks so they can tackle this issue.
Right.
Because they don't see the healthcare delivery system doing it. I think that's something, once again, that we are tackling directly. I think Ochsner did that as a nice job, kind of throughout Louisiana, is figuring out how we partner with the insurance companies to do this in a constructive, integrated and positive way.
Well, we always like to end our interviews with a quickfire round where we stuff a bunch of things that we can't fit into the normal interview into the end. And so maybe to start, what's one thing you've changed your mind on in healthcare in the past year? I
would say the impact that, and I think this is a little bit around leadership as well. I think, I think sometimes, it always takes a team to get things done, but individuals can drive massive change, positively and negatively. And the impact of a single leader who really kind of can get people around them, put together a vision and drive change can really make big things happen. I see this with lots of people that I work around. And I think vice versa. I mean, there's folks that can't tackle that and don't get that done. So that's been a little more, I mean, not just kind of healthcare specific, but I think leadership specific. And I wouldn't say I've necessarily changed my mind, but I would say that I think the speed of technology change in healthcare, which has been slow for a long time, and I think there's been limited benefit yielded in many cases, I think is really going to start to prove out to be very, very beneficial.
It's really fascinating to see because I'm, do general AI investing, and I feel like healthcare is usually, one of the last industries to adopt a lot of these technologies. And in AI, it's really been one of the first. And I think, maybe healthcare and legal at scale have been the earliest adopters, which is great to see.
Yeah. And I think one of the things that we need to do in healthcare, and I try to do, is let's keep looking at other industries.
Yeah.
Like look at other industries and what they're doing and how they're using technology and how they're approaching things and why they're approaching things. And I think, and then think about that application in healthcare and how we could do it different.
Yeah.
That's, I think that will open up our thinking to maybe tackle things that maybe we wouldn't have done if we were just looking at through our pure healthcare lens.
Is there another industry like you've taken inspiration from?
I mean, I think lots of industries. I mean, airlines and on my phone, on my app, I can change my flight. I know where my bag is. I know where the plane's coming from. I know whether it's on time. I mean, I know everything, right? We can learn a lot from just that in healthcare, right? On the consumer side, and Amazon, buy pretty much anything, and kind of where it is when it's coming, so I just think this. I mean, knowledge and predictability is important, and once again, I think even people can wait if they know like when something's going to happen.
Yeah, totally.
Right.
But just having that information.
Yeah, I mean, just having that information, and or if they got to wait, they could pick another path if they don't want to do that. So I think I joke around sometimes with some of our physicians and clinicians and employees that, hey, if United tomorrow said, hey, we're going to shut our app off, but don't worry, we're going to add a lot more customer service people on the phone, and you can only buy certain seats, but we'll talk to you 8 to 5, I mean, people would be like, that's insane. I'm like, well, that's what we do in some cases, right? So let's tackle that. Let's take that on. And buying an airplane seat isn't the same as getting the right appointment with a clinician, and I fully understand that. And there's more complicated issues around that. But I do think we can learn from that and think about how it could be applicable and what pieces could we do. And that's why we've gone from, 2.5 million visits to 5 million visits over the last couple of years. And I think that will just continue to escalate.
What's an example of something that you thought would work at Sutter, but maybe it didn't, or conversely, maybe something you didn't think much of that actually ended up being a huge success?
I think there's certain locations that, we thought, or projects that we thought, would be the best, and we ended up, having to shelf them and move on to other things that, were better opportunities. I would say that the adoption, of change, through the organization, which has been actually very, great, and the team's done an incredible job. But there's pockets where, there's resistance, and even if we can paint the path and people see it, but there's always, reasons for resistance or whatnot. But I would say that's something that, has been, a little challenging from time to time. I think people, when you, and within the organization, when you really lay out clarity and you're transparent and you help people understand the why behind things, like, why are we doing this? Like, why is this really going to be great for patients? Why is it really going to be great internally? Then I think people, really can get behind something versus, I think lots of times we tell people what we're going to do or how we're going to do it, but people want to know the why. I mean, I know Simon Sinek talked a lot about this, years ago, but it's still applicable today. And I would challenge us all to think about, lead with the why, and the what and how can kind of come behind, and then people can kind of get behind it. And it's interesting looking at some projects that and some leaders that really they jump right into the solution and the how versus getting to the why, and that's I think that many times it's limiting.
Yeah. I guess on this theme, I mean, obviously you've been a hugely successful health system exec for a long period of time now. As you think back on all the things you've learned, and if you could go back 30 years and give your younger self some advice, what would you say?
We all go to that school, the school of hard knocks, right? We kind of learn things that don't go well. I think one of the things is, and look, it's a constant kind of evolution for myself. Is the only person you can control is yourself, and you need to spend a lot of time thinking about that, and your attitude, your energy, your outlook, your choices, and self-limiting thinking. It's interesting. I remember when I took over as a CEO at Ochsner, and I was talking to this person who's a friend of mine. She was a banker, and I was talking to her about, well, this isn't quite going right, and that's not going right, and we got this issue and that issue, and she's like, well, aren't you the CEO? And I was like, yeah, I am. She's like, well, you better get going, And I was like, yeah, right. I mean, we all do it.
Yeah.
We all have this self-limiting, and I always say to folks, well, tell me who's stopping you from doing that. Like, we're going to call them right now. I want to call them right now and help you. And I'll do this in like a leader education, and because I'll say like, what is really, slowing you down? And then people, you come to find out, like it's their own thinking.
Yeah.
And all of us do it. I mean, so I think this idea of like, control yourself, be thoughtful about how you manage yourself. And that's an evolution. Like, I mean, it's, and I think the other thing I would say that, it took me a while to figure out, frankly, is, and Pat Quinlan, who was the CEO at Ochsner that I worked for a number of years, is this idea of tying to purpose. Like what is your purpose and what are you trying to accomplish, And getting in healthcare, it's pretty easy to see what the purpose of healthcare is, right? So when you start talking to people about, hey, we exist to take care of patients. Like that's what we do. We change and save lives every day. It's easier for people to kind of get excited or motivated or want to change because of that, right? I mean, it may be more difficult in some other types of industries, right?
Yeah.
But if you can tie back to the good you're going to do in the world and the impact you're going to have as that leader in the world, I think it just creates a lot of clarity around what you need to tackle. And I think those would be things that, now, I may tell my younger self that. Now, whether I could actually understand it or not, that's a whole nother conversation. But I think that would be what I would try to help my younger self understand.
Yeah. No, I love that. I mean, I think it's the perfect note to end on. I guess maybe I'll just leave the last word to you. Like, where can folks go to learn more about you, Sutter, anywhere you want to point them?
Yeah, so I would say, obviously our website, you can look us up on the web, and there's a lot of information on there about Sutter. About me, it's really not about me. I mean, what I would say is that our team is incredible, and our physicians and clinicians have been incredible. And learning about them and learning about what they do, and learning the impact they're having, that's all kind of sits on our Sutter website, in our press room, about the great things that are going on in our strategic initiatives. And I think the other thing is, look at our annual report, because I think we really try to highlight the great things going on in our annual report, which is really a report to the community. So take a look at that, and we have a lot of great things that came through 25, and we'll be posting the 25 report in early 26.
Amazing. Well, thanks so much for doing this.
Hey, thanks for the opportunity. Great to be with you.